Now that I'm embarking on this journey, I want to ask you something. When was the last time you had your eyes checked? So I'm talking about not your glasses prescription updated, not your contact lens renewed. I mean actually checked, where someone sat down with you and said, here's what I see, here's what it means, and here's what we need to do about it. If you're like many patients, especially younger ones, honestly, the answer is either a few years ago or I can't remember. And I get it. If your vision seems fine, why go? Nothing's blurry, nothing hurts, life is busy. But here's what 18 years of looking into people's eyes has taught me. By the time something hurts, by the time something blurs, you are usually already behind. Because your eyes are like many other parts of your body, they don't wait for you to notice. They've been sending signals for months, sometimes even years. Quiet signals, easy to miss signals. And most people, through no fault of their own, never learn how to read them. And that's what all this channel is about. My name is Dr. Murtaza Jafarji. Most of my patients just call me Dr. J, and I want to welcome you to my channel, Eyes Don't Lie. So let me tell you a little bit about who I am and why I started this channel. I'm an optometrist. I've been in clinical practice for just under 2 decades. I own a specialty eye care clinic called Urban Optometry in Ontario, Canada, where we focus on dry eye disease, eyelid health, myopia management, specialty contact lenses, photobiomodulation, and intense pulse light therapy. I'm also the inventor of Lid Genie, a clinician-developed eyelid health system I created because I kept watching patients suffer from chronic eyelid and dry eye issues without having access to the right tools at home. So now I want to be real clear about something upfront because I think it will help you understand the spirit of this channel. So I'm not here to replace your eye doctor. I'm not here to give you a diagnosis through the screen. What I'm here to do is to give you something that most patients never get, and that is contacts. Tens of thousands of patients teaches you things that are hard to put into a 15-minute appointment. There's patterns, there's connections, questions patients wish they asked, the things that I wished I had time to explain more fully. So this channel is where I finally get to say all of it. But here's the foundational idea behind everything I do and everything you're going to hear on this channel. Your eyes are the only place in the entire human body where a clinician can look directly at the living blood vessels, the living nerve tissue, the living vascular structure without making a single incision. And think about what that means. When I look into your eyes, I'm not just checking whether you need glasses, I'm looking at the health of your blood vessels, which tells me things about your cardiovascular system and your metabolic health. I'm looking at your optic nerve, which can show early signs of neurological changes. I'm looking at your retina, which is an extension of your brain. I'm looking at your cornea, your lens, your eyelids, the lid margins, and the meibomian glands. And what I see, especially when I compare to what you tell me about how you sleep, what you eat, how much time you spend on screens, how stressed you are, creates a picture that goes far beyond vision. And over the years, I've had patients come in for a routine exam and leave with a referral to their family doctor for undiagnosed diabetes, hypertension, autoimmune conditions, and even early neurological changes like multiple sclerosis. So they came in thinking they needed eyeglasses, and their eyes told a completely different story. But this isn't me trying to alarm you, it's actually the opposite, because here's the flip side to this. So if your eyes can reveal early signs of disease, they can also confirm early signs of health. And that is the opportunity most people are leaving on the table. So now let me give you 3 specific examples, real categories of things that your eyes are communicating right now, whether you're listening or not. So first is the state of your ocular surface. Most people think that dry eyes is just dryness. Like you feel a little scratchy, you grab some eye drops and done. But your ocular surface, the front surface of your eye, your tear film, your eyelid margins is one of the most sophisticated, complex biological systems in your body. It's a layered ecosystem. When it starts to break down, it almost never announces it. It kind of whispers. It says, I feel tired at the end of the day, or my eyes are a little red sometimes, or my vision gets slightly blurry and then clears up. Or my favorite is my eyes water all the time. So I can't have dry eyes, right, doctor? But in fact, that's wrong. Watery eyes can absolutely be a sign of dry eyes. It's called reflex tearing. When your eyes are so dry and irritated that they produce a flood of watery tears to compensate. It's actually like a paradox, but it's real. So the point is, your ocular surface is telling you something, and the longer you wait, the harder it becomes to reverse the damage. The second is your metabolic and cardiovascular health. So this one surprises people the most. So the blood vessels on your retina, the thin layer at the back of your eye, are the direct mirror of your systemic vascular health. When blood sugar is elevated over time, those vessels change, they leak, they become irregular. When the blood pressure is chronically high, we see changes in those vessels. We see the crossing each other and then how they narrow and thicken. Diabetic retinopathy is one of the leading causes of blindness in working age adults worldwide. And in many cases, many of these patients had no idea they were diabetic until changes shows up in their eyes. Again, I'm not saying this to scare you. I'm saying it because this is exactly the kind of a thing a comprehensive eye exam is designed to catch. And it's not just whether you need, a -2.5 or a -3 prescription. And the third example is your lifestyle in real time. And this one is a little harder to measure on a slide, but it might be the most important. So your eyes kind of respond to how you live. Example is, say you are sleep deprived. Your tear films will suffer within days. If you have poor omega-3 intake, it shows up in your meibomian gland function over weeks and months. Chronic screen time without breaks. The blink rate drops significantly and your ocular surface pays the price. On the flip side, and this is what drives my entire practice philosophy, the right lifestyle interventions can produce visible, measurable improvements in ocular surface health, in the meibomian gland function, in the tear quality, in the corneal health. I've seen patients turn their eyes around with changes to their diet, their sleep, their screen habits, and their eyelid hygiene routine. And that's what eye care from inside out means to me. Not just treating symptoms at the surface, but understanding and addressing the root causes. Now here's something I want to be honest with you about. So the way most people interact with eye care is kind of reactive. Something goes wrong, vision blurs, there is discomfort, there is redness, and then they book an appointment. And look, I understand that. The whole healthcare system in many ways is built reactively. But eye disease, most of it does not play by those rules. So things like glaucoma, macular degeneration, diabetic retinopathy, even significant dry eye disease with meibomian gland dropout, these conditions progress quietly. They don't send you a warning email, they don't tap you on the shoulder. So by the time you feel it, by the time you really notice, something has already been lost. And sometimes that what's lost doesn't come back. Now here's what keeps me up at night, and I say this as someone who genuinely loves this profession. It's not the disease themselves. Modern optometry has incredible tools to detect and manage them. It's actually the gap. So the gap between what we know and what most patients ever actually hear. So the gap between a 15-minute appointment where we say, your eyes look healthy, see you next year, and a real meaningful conversation about what healthy looks like and what threatens it and what you can do right now to protect it. And that gap is why I built this channel, because I think you deserve more than a prescription and a see you in the next year. I want to share something personal with you, because I think it explains not just this channel, but the way I practice. So before I became a clinician, before I started optometry school, before all of it, I was a teenager who just moved to Canada from Tanzania. And one summer of graduation, I had the opportunity to volunteer at a rural eye camp back home in a remote village. There I literally watched a doctor with a small table, a handheld instrument, and almost no resources change people's lives. People who had been living for preventable vision loss for years. People who had access to basic eye care was not a given. And that experience never left me. It shaped everything about how I think about this work. Eye care isn't a luxury. Clear, comfortable, lasting vision is something every person deserves access to, and knowledge is the first step towards that access. And if you're watching this in Toronto or in Texas, in London or in Laos, you may have more resources available to you than those patients did. But if nobody's told you what to look for or what to ask or what to do, you're still in the dark. And that's what I want to change. So here's what you can expect from Eyes Don't Lie, the channel. Every video on this channel is going to give you something real. Something you can take away and actually use, whether that's a question to ask at your next eye exam, a habit to add to your morning routine, or just a deeper understanding of what's happening inside your eyes. Now, just to give you a sample of what we are going to cover, so things like eyelid health and dry eyes, going to talk about screen time crisis, what it's actually doing and what actually helps. We're going to cover nutrition and lifestyle, the evidence-based stuff and not just the supplement marketing, your kids' vision, the myopic epidemic is real, and it's accelerating, and parents need to know the truth. We're also going to cover advanced eye care technologies like IPL, orthokeratology, scleral lenses, mammography, all in plain simple English. The systemic connections, your heart, your gut, your hormones, your sleep, and how all show up in your eyes. And if any part of this resonated with you, or if you have ever felt like you're left an eye appointment with more questions and answers, this channel is for you. So make sure you hit the subscribe, turn on notifications, and if you know someone, a parent, a partner, a friend who's been putting off their eye health, share this video with them. Because here's the thing about prevention. It only works before something goes wrong. Your eyes have been watching over you your entire life. Now it's time to return the favor. I'm Dr. J, and remember, eyes don't lie. Now please make sure you watch the next video, because that's where I'm trying to tie everything together. It's called Eyes Don't Lie, but Lids Do. This is where I'm trying to break down my 3 core principles for eye and vision longevity that I try to teach my patients every single day, because I believe prevention is active awareness. So I'll leave it at that, and I'll see you in the next one.